Welcome to a deep dive into a topic that, well, often stays in the shadows, but it's incredibly important for understanding health, disease, even legal stuff. Postmortem examinations.
That's right.
We've looked at the sources you sent, and we're going to unpack what these exams are, why they happen, and sort of what goes on step by step.
Yeah, the whole process.
Our mission today is really just to give you a clear picture, that drowning you in jargon.
And it's fascinating, isn't it, how something that seems quite mysterious is actually a very structured process.
Medical and legal.
Exactly. It's all about getting clarity, but also contributing to, wider medical knowledge and hopefully giving some peace of mind.
Okay, so let's get into it. A postmortem examination, we often hear autopsy. What are we actually talking about here?
Well, simply put, it's the examination of a body after death.
Right.
And the main aim usually is to work out the cause of death. How did this person die?
And it's not just any doctor doing this.
Oh, no, absolutely not. These are done by highly specialized doctors, pathologists. Yeah. Their whole focus is understanding disease, the nature of it, the causes. They're like medical detectives in a way.
Okay, and with something so sensitive, who makes sure everything's, up to scratch?
Yeah.
Standards and all that.
Right. Well, the key bodies here are the Royal College of Pathologists and, importantly, the Human Tissue Authority, the HTA.
HTA, okay.
They set the standards, the guidelines that pathologists have to stick to, making sure everything's done properly and ethically.
So why are they necessary? I mean, beyond finding out the cause of death, what's the bigger picture benefit?
Oh, it's huge. They give us invaluable information about how someone died, when, why. But also, critically, it helps pathologists understand how diseases spread, how they affect the body.
So it feeds back into medicine.
Directly. That knowledge helps develop more effective treatments for patients down the line. It raises a key point, though. How do families actually deal with this?
Yeah, good question. If, say, a child or partner or relative has died and a postmortem is needed, who helps them navigate it?
Usually, hospitals have bereavement officers. They're the main point of contact, there to offer support and guidance.
Right. That's good to know. Now, you mentioned something interesting before, that there are different types of postmortems.
Yes, exactly. This is really important. There are basically two main routes initiated by different people.
Okay.
They're either requested by a coroner or they're requested by a hospital doctor.
Okay, let's break that down. The coroner first. Who actually is a coroner?
So a coroner is a judicial officer, usually a lawyer or a doctor, and they need at least 5 years' experience.
Right, so it's a legal role.
It is. They're responsible for investigating deaths in specific situations. Usually a doctor or the police will refer a death to them.
And what kind of situations trigger that? When does the coroner get involved?
It's quite a wide range, actually. Things like unexpected deaths, sudden infant death syndrome, SIDs.
Okay.
Or violent, unnatural, or suspicious deaths like suicide, maybe a drug overdose.
Right. Anything not obviously natural.
Exactly. Also, deaths from accidents or injuries, maybe deaths possibly caused by someone's job, industrial diseases, even deaths that happen during or soon after a hospital procedure, like surgery.
Okay.
And importantly, if the person who died hadn't been seen by the doctor who could issue a death certificate, that's the MCCD, Medical Certificate of Cause of Death, within 28 days before they died or any time after death.
Or if the cause is just completely unknown.
Or if the cause is just unknown, yes, the coroner needs to find out.
So when a coroner orders one, what's the number one goal?
The primary aim is to find out how the person died, medically speaking, and then decide if an inquest is needed.
An inquest that's like a legal hearing.
Precisely. It's a formal legal investigation into the circumstances surrounding the death. Who, how, when, where.
Okay, and here's a crucial difference, I imagine. Consent. Does the family need to agree to a coroner's postmortem?
No. This is key. Consent from the family is not required for a coroner's postmortem.
Why is that?
Because the law actually requires the coroner to investigate deaths that are suspicious, sudden, or unnatural. It's their legal duty.
Got it. So it's mandated by law. What about tissue samples or organs in these cases? Are they always returned right away?
Not always, no. Sometimes samples of organs or tissues might need to be kept for a while.
Why?
Well, maybe until after the inquest, or sometimes much longer by the police if the death was suspicious. Could be months, even years in complex cases.
Wow.
But the coroner's office will always discuss this with the family if samples need to be kept. They'll explain why.
Okay, that's clear. Now, let's switch tracks to the other type, hospital postmortems. Why would a hospital doctor ask for one?
Several reasons. Maybe they want to get more information about an illness the person had or understand the cause of death more clearly. Sometimes it's specifically for medical research to advance knowledge.
Right.
And interestingly, sometimes the family themselves, a partner or relative, might actually request one.
Oh, really? To get answers for themselves.
Exactly, for their own understanding and peace of mind.
Okay, and the big question again, consent. Is it needed here?
Yes. Absolutely, 100%. Hospital postmortems require consent.
From who?
Either consent given by the person before they died, maybe they signed something, or if not, then consent from a close relative after their death. It's completely consent-based.
And can these be more targeted? You said coroner's ones are often quite broad.
Yes, they can be. Unlike a coroner's, which is usually pretty comprehensive, a hospital postmortem can be limited.
How so?
Well, the family or the person giving consent can agree to limit it to specific areas, just the head, say, or the chest, or the abdomen.
Okay.
That scope is always discussed when consent is being sought. They can only look at what's been agreed to.
And there's time to think about this decision.
Definitely. The HTA actually recommends giving people at least 24 hours to consider.
Seems fair.
Yeah, and you should get contact details, too, in case you change your mind. It's a big decision.
Okay, so the decision's made, consent is given, or it's a coroner's case. What actually happens during the examination?
Well, they try to carry it out as soon as possible, usually within, say, 2 to 3 working days after death, sometimes even faster, maybe within 24 hours.
Can families see the body before or after?
Often, yes. Depending on the timing, you might be able to see the body beforehand. And after the examination, the organs are returned to the body.
Oh, they are. Okay.
Yes. And usually, families can view the body again afterwards, before the funeral.
Where does this take place?
It happens in a special examination room. It looks a bit like an operating theater, actually.
Sterile environment.
Exactly. And these rooms are licensed and inspected by the HTA. They have to meet strict standards.
And during the procedure itself?
The pathologist opens the body and removes the organs for examination.
Okay.
Sometimes they can tell a lot just by looking at the organs, but often they need to take small samples for more detailed tests, looking under a microscope, maybe toxicology tests. That part can take several weeks.
So the initial cause might be clear quickly, but full results take longer.
Precisely. Then, once everything's finished and the release papers are issued,
What happens then?
the undertakers, the funeral directors the family has chosen, can then collect the body from the mortuary and start preparing for the funeral.
Okay. So the examination is done. What about the findings? How does the family get the results?
The pathologist writes up a report detailing everything they've found.
Right.
Now, if it was a coroner's postmortem, the coroner or their officer will tell the family the cause of death.
Directly.
Usually, yes. And the family can actually ask for a full copy of the pathologist's report. There might be a small fee for that, though.
Okay.
Sometimes they might send the report to the hospital doctor or the GP to discuss it with the family instead.
And for the hospital postmortems, the ones that are done with consent.
In that case, the family needs to request the results from the hospital where it took place. Again, maybe a small fee.
And then who explains it?
They can then discuss the results with the doctor who was looking after the person before they died or with their own GP.
All right. And you mentioned the HTA website has more info.
Yeah, the Human Tissue Authority website is a really good resource. It explains what happens before, during, and after in more detail.
We keep coming back to the HTA. Let's maybe dig into their role a bit more. Why are they so important in all this?
Well, they're absolutely crucial. Their main job is making sure human tissue is used safely, ethically, and critically with proper consent.
So they regulate the whole process.
They regulate organizations that remove tissue, store it, use it, whether it's for research, treatment, postmortem exams, teaching, even public displays like in museums.
Wow, okay.
And all places where postmortems are done have to be licensed by the HTA. They inspect them regularly.
It sounds like a really vital layer of oversight and trust.
It absolutely is. It ensures dignity and respect are maintained throughout.
Finally, amidst all the procedure and the science, we absolutely have to remember the human side of this.
Oh, completely. For families who are grieving, understanding why their loved one died can actually be a really important step.
Part of the grieving process.
For many, yes. It can help them come to terms with the loss, even though it's incredibly difficult.
And support is available.
Yes. Talking about it, sharing feelings, that helps. Family and friends are often the first line of support, of course.
Sure.
But GPs can also help. They can connect people with local bereavement services, counselors, support groups. There is help out there.
That's really important to emphasize. So wrapping this up then, what does this all mean for you listening? We've sort of journeyed through this complex area, postmortems,
Yeah, looked at why they happen, the different kinds.
the actual process, how careful it is, and the role of bodies like the HTA ensuring it's all done right.
And if you look at the bigger picture, it really shows how medicine, law, and, personal experience all intersect when we try to understand death.
It's quite profound, really.
It is. It's a testament, I think, to how seeking knowledge, even after someone's gone, can lead to healing for families, sometimes justice, and definitely helps advance medicine for everyone else.
Okay, here's something to really think about as we finish. We've touched on how postmortems have shaped medicine historically, things like SIDS. But think about the future. How might new technologies with care, maybe less invasive methods, advanced imaging, AI analysis, how might they change postmortem exams? Could they redefine our understanding of life, death, and disease all over again?
That's a fascinating question. The potential is huge.
Something to ponder. We hope this deep dive has maybe demystified things a bit and given you new appreciation for this field. It's often misunderstood, but it's incredibly impactful.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.